Well, good evening, everyone. This is November 15th, 2021. This is Monday night, Talk to the Doctor, where we here at Tustin Longevity Center make an open forum for you to ask general questions of any nature. You don't have to be a patient here. We are integrative functional doctors and medical doctors, MDs, naturopaths, and gynecologists that are all trying to use as natural as possible means to help our patients in conjunction with our standard of care. So we welcome you today, and we are looking that we're probably calling you TLC Freedom Health Tribe, and I think Sean came up with that, TLC Freedom Health Tribe. So I think I'm going to say hello, tribe. And I think the first thing we should do is very important, and that is start with a joke. And so levity is a good medicine. So how does a receptionist that works at a urologist office answer the phone? And the answer is, she says, "Urology office, can you hold, please?" So I think some of you will understand that if you understand benign prostatic hypertrophy. Anyway, so that's a little joke. And we're already having lots of questions starting up. Again, this isn't meant to be medical advice for anyone specifically, but it's a general approach. So you have access to a physician who is working in general medicine, gynecology, and the functional integrative medicine world. So today we're going to start with Lynn, and she says, today symptoms remain, but BP is normal, oxygen is good. I haven't taken any fever medications. Any thoughts or suggestions? Never had a fever lasting 7 days. She says she was diagnosed with MS in 2000 and started daily Copaxone injections. No relapses to date. Any concerns with taking an immunosuppressant drug that blocks T cells, trying to build strong immune system? So in general, the Copaxone is the standard of care for MS, and it's given at various doses. I have some people that use it only once a week, some people 3 times a week, and apparently Lynn is using it every day. So she's getting this from her rheumatologist, most likely. And the question is saying here, I haven't taken any fever medication. BP is normal. She apparently thinks she has a fever, but it needs to be measured. We call a fever 100.4 or higher. If you're experiencing a fever, you would take a temperature, and if it's at 100.4, this is something that you should notify your rheumatologist who's giving you the Copaxone injections. So she's aware of that, because yes, immunosuppression, as MS is an autoimmune disease that kind of works attacking the myelin sheath, the lining that surrounds our nerves, and then that will create symptoms for them with muscle and discoordination and weakness. So number one, Lynn, if you are having a fever of 7 days, then I would let your rheumatologist know. But again, a fever is 100.4 Fahrenheit. And that's what I would do. Now, of course, we would say do all those wonderful things that are supportive. Drink plenty of water. Find out what your food allergies are, because we see MS as taking in a food lectin over and over again, like marketing the glyphosated wheat or the genetically modified wheat. And if your blood type, especially if you're an O, they tend to be very sensitive to that. But food allergies could be from many sources. So an A and a B type blood could get this. And this will create this chronic inflammation in the gastrointestinal system. That chronic inflammation can kind of cross-react and start attacking the healthy fats and structure. You know, remember, we're always talking about you're made up of cells, and this is like a cutout of a part of the cell membrane there. These are phospholipids and proteins. So your cells are 50% protein, 50% fat. So eating a rich, healthy protein and fat diet with digestive enzymes, low carb, and taking systemic enzymes for inflammation as well. There are many things that we do with MS. But again, Lynn, please contact your rheumatologist, your doctor, and we'll go from there and leave it at that. Debbie says, hi, Dr. Rita. Hi, back to you, Debbie. My friend, early 60s, has persistent postural perceptual dizziness for 2 years. She feels like she is drunk or walking on a boat. Real bad in the morning. What causes this and how do you fix it? Well, there could be many things, but in general, anything you can do to disinflame the body is going to reduce the inflammation around the loops of Helene in the brain. These loops are in 3 different spatial levels in your body. So if you turn your head one way, the fluid in these loops of Helene, Helene, then the water will move to the right, and that sends back signals through little hairs that are in these tubes back to the brain. That gives you a sense that your head is tilting if you lean forward or you lean backwards and so forth. Now, as we age, the tininess and the minutia of the loops of Helene and our capillaries is very much impacted by even allergies seasonally. It's impacted by a blood sugar that slowly climbs up with age and triglycerides thickening the blood. So dehydration will produce this. I would drink a big glass of water, 16 ounces before bedtime, and I would be on an empty stomach, not eating after 6 p.m. And then I would take like 5 Vitalzyme or even 10, so that throughout the night, the enzymes are chewing up any sticky debris. If you stop eating by 6 o'clock in the evening, that's going to give your body a lot of time to burn down any triglycerides and sugar. Be low carb. Food allergies will cause inflammation like the first lady. And we would say fasting would improve this. So this person needs to look at their blood sugar. They need to look at food allergies, their hydration, get on systemic enzymes like Vitalzyme we have here or Vitalzyme. Stop eating after 6 o'clock, drink extra water, and take enzymes before bedtime. And that usually is the cause and clears up with it. Of course, if there was meningitis or there was a known infection or if there was trauma, these would be separate issues, but that's generally how you would approach it, Debbie. Lynn says, should a person continue taking ivermectin beyond 5 days if symptoms have not improved? IMASC reads 5 days or until recovered. Yes, the answer is yes to that. The average recommendations, remember, these are recommendations, and you should be seeing your medical doctor to address this. So the answer would be yes. 10 days would be just fine. And then probably stay on a maintenance of twice a week once you're feeling better. That's the general findings that we're seeing as doctors at this time. So that's that question. Deborah says, hi, Deborah. Is it true that ivermectin has anti-cancer properties? Yes, indeed. There's another article that recently was published. Let's see, where is it? I have this article here in Pharmacological Research, and the title is Ivermectin, a potential anti-cancer drug derived from an antiparasitic drug. And basically, the the findings are saying recently ivermectin has been reported to inhibit the proliferation of several tumor cells by regulating multiple signaling pathways. This suggests that ivermectin may be an anti-cancer drug with great potential. Here we reviewed the related mechanisms by which ivermectin inhibited the development of different cancers and promoted programmed cell death. So when a cell gets old or injured, it should have an automatic self-destruct and then autophagy, and that's why fasting is so useful. You help facilitate cleansing. That's why I do a 5-day fast twice a year, and I usually do intermittent fasting where I'm always skipping breakfast. So my stomach will be empty roughly from 6:30 p.m. until around 1:30 the next day. One lunch time per week, sometimes twice, and I will go 24 hours, dinner to dinner. And so that's always very valuable. And discuss the properties for the clinical application of ivermectin as an anti-cancer drug for neoplasm therapy. And there were several types of cancer that these are general, it's not specified, but breast cancer has been studied, digestive system cancers, urinary tract system cancers, hematological, like having leukemia, reproductive system cancer, brain gliomas, respiratory system cancer, melanomas, and so I found that very interesting. So it's a lengthy article, and we have been aware of that, Deborah. So thank you very much on that. Colleen says, is Forte or are Forte injections a good source of bone building? You're talking about these type of medications that are involved. Let me see if I can look this up. Bone density medicine injections. And let's see if I can find out about Forte. Here, Forteo, that's the name of it. Okay, see, yeah, it's Forteo, Forteao, a prescription medicine. This has been around a long time, and Forteo and other similar medicines are associated with osteonecrosis, where they kind of chew out the bone matrix in your jaw for some reason, if you're not weight bearing. So there's something in the signaling pathway I'm not sure that we understand completely about that. And I have been very successful in using natural hormone replacement therapy if they monitor your estrogen and progesterone, and if you're on systemic enzymes, because young girls have enzymes. So if you're old enough to be on hormones as an adult, you need to take additional systemic enzymes, be low carb, drink plenty of water, and stomp. Remember how that sudden deceleration, punching into a bag or something, or jamming the floor. You know, in the old days, women had hard sole shoes, and so they did not have all this cushioning. So there was always a bit of a shudder up the bone, and they would chop the head off the chicken and chop up the little branches for things. So they had quite a good deal of sudden deceleration for that. So I don't believe that it's necessary to use that drug unless there's some other extenuating circumstance, and we've done very well. I like to bring up a report of a woman who's in her 80s, who I've been following for many years. This is covering the last 8 years from February of 2020 compared to July of 2012. And I encouraged her not to use the injectable bone stimulation of things like Forteo. and her spine improved from a -2.3 up to a -1.3 over the years, and her hips went from a -0.7 to a 0 normal, and a bone building. I think there's safer and healthier way. Yeah. Then the next question is, how do you feel about Retin-a? Many thanks. Retin-a is a type of medicine that's based off of the vitamin A, and it's a fat soluble, and you could theoretically use too much and it could harm your liver. It also is associated with malformations in the fetuses in a pregnant woman. So if girls would get off of the juice and soda pops and lattes and juicing things where they're getting too many carbs, starches, this will raise the average blood sugar. And believe me, we've had an explosion of obesity and diabetes in the children and teenagers with this past lockdown and all this junk food eating. We're mostly consuming foolish sugars in our drinks, including smoothies and juices and so forth, not to mention any soda pops or candy or ice cream and stuff. So I believe that there's safer things than to risk a pregnancy, a deformity, liver damage, and the like. And that is with this healthy lifestyle and diet and of low carb, and then adequate water. And then we use Argentin 23, which is the hydrosol silver, which is nanoparticulate. And we have a spray that we put on the face, which is antibacterial, antifungal, and antiviral. And this has even been studied at Bethesda Naval Hospital in 2009 for Ebola. So I don't like Retin-a, and I don't prescribe it. Especially the oral form. There is a topical form, which is less problematic, but we get the same good results with lifestyle and simple, safe things like Argentin. Let's see. The next one is, oops, I went too far. Okay, there we go. Let's see, Dolphin, trying to be proactive in the face of V injuries. I have ivermectin, quinine, vitamin D for relatives who don't believe in natural medicine. What dosages can I give them if they start having problems or coming down with a cold? Well, I encourage, and I feel it's very safe to give almost anyone if they're not having known liver disease, like an alcoholic, to give them 5,000 international units of vitamin D3. And I take 15,000 every day, sometimes 20,000. So 5,000 is quite safe. In 40 years, I've only seen one person that had a problem with excess vitamin D. And I've been prescribing this for decades, and I've been using 5, 10,000, 15,000, some people 20,000, and it's very safe. So that would be good for the vitamin D, 5,000. Ivermectin is prescribed on a microgram or milligram per kilogram. The general trend is that if you're about 100 pounds, 8 milligrams, then somewhere between 100 and 110, maybe 10 milligrams at another 10 pounds, 20 pounds, 12 milligrams. So roughly at 100, it's 8 milligrams. At 150, it's 13 milligrams. At 170 pounds, it's 15 milligrams. At 190 pounds, it's 16 milligrams. At 200 pounds, it's 18 milligrams. At 230, it's 20 milligrams. So if you go on the FLCCC Alliance, flcc.org, you can get this eye mask protocol, and it shows the by weight as well. You should be under the guidance of a physician to help you on this. Quinine is like hydroxychloroquine. I don't think you need both hydroxychloroquine and ivermectin at the same time. Instead, I would use quercetin. And probably one of the most reliable quercetin sources is in the Orthomolecular's DHIST. D is in the letter D for dog, D-HIST, DHIST. And I have not used any of my ivermectin or hydroxychloroquine, any of that. I have just used about 800 milligrams of quercetin every day for my allergies because it's a natural antihistamine. And of course, they should be suppressing their immune system by eating so many carbs or eating late at night, drinking enough water and so forth, getting sunshine and so forth. So hopefully that helps you, Dolphin. Carol says, is melatonin necessary? If you can't take it, what is the alternative? Sleep hygiene is being ruined in the current society with all the lights that we're able to turn on with a flick of a wrist, living too busy of a life. There are many outside stressors, mental stressors. There's family division over issues lately. And then eating late at night will turn off your brain for going to bed. Lack of hormones as you age, lack of hydration, so your brain can calm down. There are many things that are involved in good hygiene. Exercise is also very good for getting a good night's sleep. So if melatonin is not working for you, you could take magnesium. Some people, I give the OptiMag Neuro powder, a scoop of it, with the vitamin C powder. Mix it together as a drink and drink it before bedtime as a relaxant. We have TLC Calm or other calm herbal products that have ashwagandha in it, passion flower. These are very nice calming agents. Benadryl is yet another source. Hopefully you wouldn't become addicted to Benadryl. A lot of people use that antihistamine to let their babies. I remember in the military back in the 80s, late 70s, people would fly overseas. They would bring their children, and that's a long flight. And so they asked what could they safely give that isn't a opioid. So I told them to get some liquid Benadryl and give them a evening dose of that, and that tends to be relaxing and calming. So good hydration. Try and spiritually have a source that calms you from the stress. Watch the electromagnetic lights and energy waves. Get those machines away from you. Water hydration, natural hormone replacement therapy, magnesium with vitamin C before bedtime. And then there's herbal ashwagandha, passion flower. These are things that typically help. So hopefully that helps you a bit, Carol. Debbie said, ha, 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 funny joke. I have another one for you too, Deborah. So I have that. Damien, hi, Damien. You said, ha, 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 I love your joke also. Also like the name of our tribe. Yes, so TLC Health Warriors. No, TLC Freedom Health Warriors. Yeah. It's a good one. Thank you, Damien, for your thumbs up on that. Lynn said that I missed the first part of her question. So let me go back to Lynn at the top here. Yeah, Lynn, I said that, you were saying you have good blood pressure, oxygen is good. Your symptoms remain. I don't know what your symptoms are. If you're my patient just by name, it's not registering. So this isn't for me to manage my patients online. Your symptoms remain. I'm presuming that you're having cold symptoms. Any thoughts or suggestions? Never had a fever lasting 7 days. I assume you're having a fever, but a fever is 100.4. We need to notify your doctor on that. So, just make sure you're well hydrated and that you're low carb, and then that you are using your enzymes. And, I will take your name down and see if you're a patient. But it's not flipping a switch on me. Okay, so hopefully I did answer it. Elizabeth says, I had the Pfizer vaccine and had chelation therapy a month later. I felt very tired and had a very bad headache. Is that because the metals are being pulled out? Look, very likely, yes. These are detox kind of symptomology. I would continue doing chelation therapy, Elizabeth. And I would at least do it once a month, and be well hydrated, and eat a little something, or take the doctor's nutrition bar that's full of those phospholipids and protein while you're doing the exam, and drink at least 16 ounces of water. But yes, this is most likely a detox phenomena. If it persists, though, please follow up with your healthcare provider. Constance says, can you consult in a health directive for care once someone is not able to make their own health decisions? Finances would be taken care of. Can you consult in a healthcare directive? This is something that you have to address before you become ill and hospitalized and not incapacitated. These power of medical attorneys. There are many forms of them. Healthcare, each state has their own form. California has theirs. This has to be signed before you're hospitalized. If you have any concerns, I would get it signed and notarized so that whoever you entrust with giving healthcare directives on your behalf, should you unfortunately become hospitalized and then not able, incoherent, not able to be alert and oriented to what is going on. You have to have that done beforehand. So that's just the facts on that. Carol says, are low dose aspirins good? My husband has had valve replacement and 1 bypass surgery. Well, yes, they act as antiplatelets, and platelets are needed to aggregate and make things sticky, so it helps to inhibit that. But this is the best anticoagulant. This is water. And drinking half your weight in ounces every day. So if you're a 200-pound man, you need to drink about 96 ounces, 100 ounces. 96 ounces equals 6 16-ounce bottles every day. The other thing is you need to be low carb, and that also with some daily routine exercise. I would be on vitamin D with K2. K2 has the ability to help mobilize calcium plaques and lift them off for directing calcium to be properly deposited into the bones. I would do chelation therapy if I were having had a valve replacement and bypass surgery. And I would, of course, follow up with your cardiologist and have your routine assessments, echocardiograms, stress tests, whatever is necessary to see how well he's doing. Aspirin's reasonable, but what we give here is systemic enzymes, Vitalzyme or Vascuzyme or Proteozyme. In his case, with that history, I would probably ask him to take 4 twice a day on an empty stomach. This helps prevent blood clotting, joint pain. It helps detox the body. Aspirin doesn't do that. As a baby aspirin, it's not going to do it. It's just acting as a antiplatelet factor. Which brings up, I'm aware now that Tromethamine, Tromethhamine, is being added to the childhood recommended vaccines ages 5 through 11. And that is a drug that's been around for a anti-inflammatory acid buffer stabling system. So they must have been aware in the workup about the clotting and the propensity of this in the children. How sad. I seem to be hearing a conversation today in which they're normalizing the concept even of children having heart attacks and strokes. This is not normal. So since it's emergency use authorization and since there's almost no risk to children, and I've even heard outrageous claims of numbers of children injured from the disease COVID. I heard a number like 140,000 on some CNN, I think it was. Whereas the facts are there have been probably only, at the most, I would say the top number would be 700 deaths. And that's probably largely due to children with cancer or cystic fibrosis or other severe secondary medical problems or severe obesity of childhood. So that's a long answer for your question on aspirin, low-dose aspirins, Carol. Hopefully that helps you. Let's see. The next one is Constance says, is it okay to get up 3 times a night to go to the bathroom, but get a total of 7 to 8 hours of sleep? I guess stop most water at 6 p.m. I guess everything, I would prefer that you don't have to get up to urinate 3 times a night. And I would want to have you examined. I would want to see your urine function, your creatinine. I would want to find out how long has this been going on. I would want to know if there's any blood in the urine. Is there a good volume that is passed each time you get up to urinate, or is it a small amount? There's many other things that could be causing this. As a woman ages, her skin thins, and so the urethra, in a man it'd be very long, but in a woman it's very short, and then the mucus lining of the urethra gets thin and very easily irritated, so it makes you more sensitive and irritable to the bladder. So there are many things that can be done to help this, Constance. So I would address this with your doctor and get a good workup. Because I do think you need a good continuous sleep dynamic of 5 or 6 hours every night, rather than, sleep 3, get up, then sleep another 2, then get up, then sleep another 2, and get up. So this should be looked at because we heal when we sleep. Constance says also, how soon after taking Vitalzyme on an empty stomach in the morning is it okay to have a cup of coffee? I have my coffee right next to my water every morning when I take my Vitalzyme. So I think you can sip on it right away. But honestly, I have my big 2-liter jug of water, and then I have my coffee right next to it. And as I'm doing my home Bible study or whatever, I am taking my vitamins and I'm drinking my water, and I might take a sip of coffee. So coffee won't have anything negative constants to your Vitalzyme. Then she also asked, do you treat for COVID with therapeutics? Yes, we recommend early treatment. We've always done this, even more than a year ago. Not last summer, but the summer before, we were using therapeutics. There's ivermectin, there's hydroxychloroquine, vitamin D, vitamin C, quercetin. We use systemic enzymes here that prevents microclotting anyway, but we certainly emphasize that preventatively for the inflammothrombotic impact of this viral spike protein that promotes clotting. That's produced when you take the vaccine. So enzymes. Then there's other things as well, budesonide. So that's the steroid inhaler. Yes, so the answer is yes. Doug says, are there any adverse interactions between ivermectin and metoprolol? No, the answer is no. And none that we're aware of, and I would certainly not be concerned about it. Damien says, how do you feel about herbal teas in the evening hours? As long as you're not sensitive to caffeine. So if you were having green tea, then that might be irritating, Damien. But I love herbal teas. And I have sleepy time. You know, I have chamomile. I have hawthorn. So I have a whole tray of that here and in my home. So I'm all in favor of a nice, wonderful tea like that. So hopefully those tea recommendations would be helpful. Profile 7 says, I heard that a person who's been vaccinated can detox of it by a borax bath. Is that true? I've never heard of that, Profile 7. I've never heard of that at all. I have seen papers discussing chelation therapy. EDTA chelation is designed to detox cations, which are all positive. EDTA itself is a negative amino acid-like molecule antioxidant that attracts the cation like a magnet and pulls it out. The spike protein is a cation, and so it has the same capacity. So we do take walk-ins for chelation therapy and vitamin C here, but borax bath, I think, is unsubstantiated. Carol says, have you heard of the book COVID-19 and the Global Predators? Yes, I have heard of it. We Are the Prey by Dr. Bregan. Absolutely. I recommend that for reading. I'm currently reading Is COVID-19 a Bioweapon by Dr. Richard Fleming. And I'm also ordering, it hasn't come yet, but I'm getting the book called The Real Anthony Fauci by Robert F. Kennedy Jr. I'm also reading, right now I'm reading in Trump time. So, lots of reading, lots of articles. You know, I am either here at work, I'm either asleep, in church, cooking and cleaning, or doing research. So there you have it. That's a wonderful book. Thank you for bringing that up, Carol. Christina, it says, is the BioNTech Comirnaty now being used? The answer is no, it is not. It's not available. I am asking so that I can speak accurately when warning others about these COVID shots. Correct. Comirnaty was given FDA approval, but it is not available. They are still using the millions upon millions of Pfizer emergency use authorization vaccinations. So you are absolutely correct. It is not available. So everyone's still taking emergency use vaccines, and you cannot mandate anything anyway. But certainly not anything experimental. So the Nuremberg trials, the International Convention on Criminal Courts, the International Convention on Bioweapon laws, all of these are not really isolating whether or not it's emergency use authorization. It's just saying no one can compel you in your body to take a medical device. And this is a device, it's not a vaccine. All right, let's see what else. that was, all right. So Christina says, is it beneficial to cook with iodized salt for my family instead of sea salt or kosher salt? I like iodized salt, and now we're assuming the kosher or sea salt has iodine in it. But once again, it's kind of 6 of one and half a dozen of another. Are you going to pay a higher price to have that product show assays of its iodine content? I think not, because it's so expensive to do. So I err on the side of taking a thyroid tablet every day called Iodized or iThroid. So we have both. One's a capsule, the other's a little tablet. That way I'm getting 12.5 milligrams every day of my life. Sometimes I use more. It helps my mental acuity. It helps my metabolism. You know, the povidone nasal rinse and gargle, no, not the iodine nasal, just the oral gargle, was definitely associated with prevention and symptom resolution of COVID. So having adequate iodine in your body is very important. Isn't it interesting that that has also been removed from the American food system? When I was a little girl, all bread was iodinated bread. They removed iodine in baking, and they put bromelain in it. They put bromelain in Gatorade and Mountain Dew, and all of these heavy halogens knock off what little iodine you might have in you, and it's very necessary for metabolism and mental acuity and your immune system. So instead of worrying about all that, I would buy a Iodized. Dr. David Brownstein is a family practice doctor who's done a lot of research on that in publications. And he wrote a book called Iodine, just plain iodine. And he's helped quite a few people. I've used that as part of my research for helping my patients. I was convinced of using it and adding it to my lifestyle decades ago. So I would use iodine, a tablet, 12.5 milligrams a day. You have to remember, many people look at epidemiologically that Japanese people have a very low prostate cancer and breast cancer history. And since the breast is one of the second most active glands in your body next to your thyroid gland, and it needs iodine, there is an association that iodine deficiency is associated with fibrocystic breast. The breast is trying to grow and look for more iodine. And so we are very successful in giving iodine to our patients along with enzymes, low carb diet, plenty of water, and we find their fibrocystic breasts and so forth do well. And we really have little to no breast cancer in our clinic like the other prevalence in society. EH says, hello, doctor. And I say hi back to you, EH. Welcome to the TLC Health Freedom Warriors. No, Health Freedom Tribe. Okay. Hello, doctor. Is it safe to give kids adult vitamin D drops if they stay within their upper limits? And I would say yes. So if you have, the bottle says there's 1,000 international units per drop or 2,000 international units per drops, then you would want to give your 7, 8, and 9-year-olds more by weight. And most children are getting overweight. I treat a child like an adult when they're 100 pounds. So if it's safe to give 5,000 international units to an adult or roughly 100-pound person, then I would say easily you can give a 7-year-old, early grammar school, at least 3,000 international units a day. If they're in junior high, 9, 10, 11, I would easily give them, 3,000 to 4,000 units a day. And just ask the pediatrician to do a chemistry panel that has their liver enzymes on it, and you'll see it's totally safe and fine. If they're overweight, the vitamin D will go to the fat because it's fat soluble, and they tend to need higher doses. Um, Okay, so you went on and said, Lynn, that you've had for several days a fever between 100 and 101 with a dry cough, and you started the FLCC protocol. So that should be good enough, and then we'll follow up with you. But I would like you to keep those questions for a phone call to the front office desk, Lynn, if you're a patient of mine. And then I can address that. But in general, you can have, for 10, 14 days, a low-grade temperature. And as long as you are in general good health and not spiking above that, then it's probably just a viral syndrome. It's when secondary congestion and bacteria come along where there's a bacteria that would be taking over the inflammation. So a lot of flu virus can turn into a pneumonia, and it is the pneumonia that ultimately a person can be damaged by or die from. But the virus is the thing that created the inflammation. Sharon said, thank you for this chat. What causes GFR numbers to drop in a healthy 70-year-old plus woman with no blood pressure problems, no alcohol, no smoking, no diabetes? Any idea? Sharon, in general, when you get that chemistry printout, when they do a comprehensive chemistry, they do what is called a calculated glomerular filtration estimate. It's called an estimate. And the only way you can truly understand that is with a 24-hour urine test. And so I largely ignore that number on all my patients. It's meaningless. So I would have your doctor look at that GFR. If your creatinine's fine and your liver panel is fine, your liver enzymes, your bone enzymes, your salts, then largely that should be ignored. If there's any concern, you have to do a 24-hour urine evaluation for kidney function. Hopefully that helps you, Sharon. Deborah says, what is the usual amount of EDTA TLC uses in their chelation treatments? I found a clinic close by that does chelation IV and wanted to check on the amount of EDTA. We use 1,500 milligrams per delivery. The Cockcroft calculation can actually take your body mass, your kidney function, and calculate a very specific dose. But over almost 40 years of doing it, it really is, 6 of one and half a dozen of another. The higher you go, even if we can safely give you a higher dose of chelation EDTA, the amount of detoxing during that IV, I don't want you to get that Hertzheimer reaction, that flu-like feeling, the headache, and therefore I think being more modest and having more regular IVs is the right way to go. So ours is 1,500 milligrams. If you're a walk-in patient, you get 750 milligrams, which is half of that. Because if you are not a patient here, you will get a brief history and physical from my nurse, and then she'll contact me or one of the doctors here and will authorize it as long as you have no known kidney disease of any significant nature. 750 milligrams is quite safe. So hopefully that helps you with that answer. Sharon, let's see, I did that. All right, EH, thank you, good. Hopefully that answered that. EH, are supplements okay to go through airport scanners? Yes, they are. So I wouldn't worry about that, and just keep them in a dark, cool environment, and they should do quite fine. They'll do very, very well. And so, let's see, I don't see any more questions. It's time for another joke. So, does an apple a day keep the doctor away? And the answer is only if you aim good. And then I have another one. A boy swallowed 10 quarters yesterday. So I called in to the hospital to check on how he's doing. And the nurse said, there's still no change. So funny doctor jokes, funny doctor jokes. There you go. Anyway, I think that we have covered everything. Unfortunately, it looks like the VAERS is reporting now their official number as of last Friday. Let's see, what is the report? The report shows that there were 18,461 deaths, 875,651 reports, 91,982 hospitalizations. So 18,461 deaths. And anaphylaxis, Bell's palsy, miscarriages, heart attacks, myocarditis, pericarditis is skyrocketing. It's way above the noise. It's a true signal, so that with children having a 99.9997% risk of not getting it, I don't see why anyone would authorize children to get it. So allergic reactions. So that's the current note on the VAERS. And then there was a great article that Stephen Kirsch, he was on Dark Horse Interviews. That's a microbiologist, and Stephen Kirsch and Dr. David Malone, Malone. They were both being interviewed, and Stephen Kirsch was on it. And so he's a quite accomplished businessman and reporter, multi-millionaire. And he has been financing a lot of research. So there's an article, and this is published in, what is this published in? Where did I get this from? Oh, this is his newsletter. So you would go to Stephen Kirsch, KIRSCH' newsletter, and that's on Substack. And so this is a, about a 20-page lengthy report of statistics, worldwide data, multiple charts and so forth. Basically, he has had someone review the official data that's available to the CDC. And the title of his article is New VAERS Analysis Reveals Hundreds of Serious Adverse Events that the CDC and FDA never told us about. This was published on November 8th, Stephen Kirsch. So the summary of all these pieces of data, for instance, looking at places like Florida and other states that did not do the mask mandate or any restrictions, lockdowns, have the lowest COVID hospitalization and events. So that's a really good review. And I think, let's see what else. We talked about promethamine, that is in the children's vaccine. Well, I thought this was a good article. This is published in Humans Are Free, and this is written by, who wrote this article? Oh, this was a scientist who wanted to remain anonymous, but this is another data collection. And what he did was he was talking about the letter that lawyer sent to the CDC asking if they had any record of tracking of someone who was not vaccinated, who had COVID and recovered, if there is any evidence of them passing it on to another person. So can the unvaccinated who have been prior natural immunized. And basically the FDA letter said, no, we have no record of this, nor do we track it. So this article is another tracking, kind of like Stephen Kirsch's, and they are corroborating each other. Pfizer's clinical trial data strongly indicates their COVID-19 jab causes the recipient to develop adult immune deficiency syndrome. And that's because, remember, I had reported about the research of Dr. Peterson, last November of 2020, in which the monocytes were long-lasting, 15 months at that time, and they found spike protein in them, even a year and a half, or at least several months, I can't remember totally, but Dr. Peterson's work at MIT showed that, and how that disables the immune system and then ultimately our T cells. So these adverse, vaccine adverse events reporting system, he goes into a in-depth dive on infectious diseases seeming to follow up more aggressively post-vaccination. So that was another good article you might want to read. And I think that covers all that I was going to bring up. So with that, let's see if anything else was added. All right, Carol Constance says, thank you for mentioning all the good books you are reading. And then Carol says, Dr. Peter McCullough, MD, said no child should be vaccinated. Correct, he did say that, and I'm in agreement. And then Hope Photo G says, I'm curious what she thinks about people with fibromyalgia and chronic migraines. Well, fibromyalgia is not a known entity. It's a symptom complex, and there's no known cause for that. Same thing really with migraines. And we believe there are cytokine storms, and these can be caused by low-grade chronic infections, Epstein-Barr, cytomegalo, Lyme, Bordetella. And what we do here is we work to detox our patients, and then high-dose vitamin C, open up the blood flow and capillary passages, oxygenate well. This tends to kill them off. Sometimes I use antibiotics like tetracycline. Sometimes I use doxycycline. This tends to get these recalcitrant bacteria that don't have a cell wall, like mycoplasma, and then building them up with nutrients. And then by taking enzymes, this tends to get rid of inflammatory debris and reduce the cytokine storm. And so we usually do well with that. So hopefully that would help you. Can you do this when you are pregnant? Thanks for answering. Yes, you can take healthy things when you're pregnant, like high-dose vitamin C. You can take enzymes systemically. You can use a healthy diet that is a low carb but still healthy. I would not use the antibiotics if you're pregnant. I wouldn't use ozone therapies. We do that with ultraviolet light treatment. But many times, the younger you are, the quicker we can heal you with more simple approaches. So if you found a good integrative doctor, a functional medicine doctor, and if you go to acam.org, acam.org, that's the American Academy for the Advancement of Medicine that teaches chelation, so I teach chelation. And you might find a doctor that is near you that has done that course, which would reflect that they're open-minded and likely open to these additive supportive managements with the standard of care. So hopefully that will help you. I have one more joke to end with, because my sister's on here and I want to tell her this joke. There was a man who walked into the office where he works, and his ears were all bandaged up. And his employer said, "What happened to your ears?" And the man said, well, yesterday I was ironing my shirt and the phone rang and I accidentally answered. And then he said, okay, that explains one ear, but how'd you injure the other one? And he said, well, I had to call my doctor. All righty. I hope that brought you some joy, some fun, and for the TLC Health Freedom Tribe. And I will be on Wednesday morning, 9:45 till 10:15. It's a shorter time. And I wish you God's blessing and great health. All right. Take care. God bless. Bye-bye. Debbie, you liked that one, didn't you? Okay, good. All right.